And thank you, Mr. Cohen. It's good to see you again. We're almost done. I'd like to ask a few questions, if I could. You touched on earlier in response to some questions about risk corridors.
Okay.
And it's a program to offset huge cost increases, it being the temporary risk corridor program. Where within the administration is this program housed? Is it HHS, CMS, or where?
The risk corridors is under my program.
Okay. And the individual in charge of that program would be who?
The person who works for me, who is responsible for that program's name is Sharon Arnold.
So is it just that one person then that would be the one in charge of
Well,
that?
she runs
She
that
would
program.
oversee.
She reports to me.
Okay.
So I'm responsible, but she works for me, and that's her program that she's managing with other people, with her staff.
And there are other staff then, multiple people would help her to run that program.
That's true.
And would you be able to provide us a complete list of the staffers who do perform any service connected to the risk corridor program?
Yes.
Thank you. Under this program, if insurers are hit with costs greater than 103% of their premiums, the government will give them money. Am I correct?
That's right.
How will
and there's certain. It's a little more complicated than that, but yes.
And I've got a couple of follow-up questions that may allow you to answer that. How will the determination be made of what these costs are? I mean, is there a form or
the insurance companies will have to present data to us on their healthcare expenditures. And then it won't be until 2015 that we actually make any payments under the program.
So can you tell us exactly how the insurers will report this? I know it has to be, they're going to report it, but how are they going to report it?
There will be forms or templates or whatever that they will have to provide to us, the accounting information that will tell us what their healthcare spending has been.
Okay, and I've got follow-up too on some enrollment questions, if I can kind of shift over to that.
Sure.
The most important number, as has been reported by many news outlets, is whether individuals have paid. Does the administration collect this information? I'm just asking, do you collect this information?
Right now, we're not, but we will be.
When?
As soon as that functionality is built. I think I answered some questions about that earlier, that not all of that functionality is built yet.
Will that mean then that we have to go back, all those that are enrolled, find out whether or not they've paid, so that we'll have to go back to those that are already in? We're not collecting it as it occurs?
We ultimately will reconcile to make sure that the advanced premium tax credits, for example, are not paid with respect to anyone who didn't pay their premium, because that's a requirement that you pay your premium in order to get the tax credit.
What department would have this data?
It's going to come to my office, to my agency.
Who would be the individual that would be in charge of that operation?
That's also Sharon Arnold.
How many? So we don't know at this point how many people have actually paid for coverage.
That's right.
So are you telling me that you don't have any data, you haven't received any information as to who's paid, or you just haven't compiled it yet?
We have gotten enrollment data from the issuers with respect to the APTC payments that we're going to be making next week, but it's not on an individual basis. So they've told us who the number of people who are enrolled and who have paid, but we don't have it on an individual basis. Which ultimately we will.
And I didn't mean to cut you off, Mr. Cohen.
That's right.
Are you telling me you're going to be paying insurers without knowing whether or not the insureds have been paid?
No, we're going to be relying on data from them as to who has paid, but we don't yet have an automated system.
So if you're relying on that,
and we will reconcile that as soon as and make sure that those numbers are reconciled and are correct once we do have the capability of receiving the additional data.
All right. Well, do you know the total amount of paid from each insurer at this point? Since you're relying on that data,
we have information on what we're going to be paying to each insurer in this first group of payments that's going out next week. We do have that.
Can we go ahead and get the data that you do have, whether it's compiled or not?
I'm sure you can.
Okay. All right. I believe my time's almost expired. I'll yield back.